Paul Tyler. Welcome to another Innovation Hour. Laura, welcome. And we've got some special guests. Why don't you do the introduction and set us up for our
Sure,
discussion?
absolutely. We are back again, and today we have with us, we have Ravit from Wellbeat, and we have Brittany from Hartford Healthcare. So why don't you both, tell us who you are and what do you do? Ravit, let's start with you.
Okay, so thank you for having me again. My name is Rovit Wambardea. I'm the CEO and the co-founder of Wellbeat, EL's service for all the different healthcare organizations in order to really support them and understanding the behavioral sides of each and every individual and to know how to engage them to participate in the health plans.
Great, and Brittany.
My name is Brittany Codiana. I am the Education Program Manager for Hartford Healthcare Independence at Home. So we are in the private duty home care space, providing in-home care to the seniors in our community, covering the whole state of Connecticut.
Excellent. So very cool. Israel, Connecticut. I'm sort of like right on the edge of New York and Connecticut. First of all, Brittany, thanks so much for taking time because I know we've had Ravit on our podcast, but we wanted to bring the two of you together just to sort of talk about innovation in Hartford, innovation in the healthcare program. Can you maybe talk a little bit about the pilot? Tell us about your involvement first of all with Upward Labs, and then sort of how did you focus on Ravit's company Wellbeat for a pilot opportunity?
Yeah, so Hartford Healthcare has been part of Upward Labs doing cohorts for a little while now. We came in, our department, Independence at Home, came in on the second cohort, which is where we met Ravit and the Wellbeat team. So we chose their company and thought it would fit our space in the home care space very well, because their technology was able to help our caregivers encourage our clients in the home for care plan compliance. So whether that's encouraging them to shower or do their exercises, we were able to use the Wellbeat team and that software to encourage them in a language that they really understand and feel motivated by. So the technology was great. It gave the caregivers really quick, easy to digest tips on how to encourage the client to do whatever it is they were trying to get them to do. So I really like the Wellbeat team because they were really responsive and flexible in choosing something that was really important to us. So we are really focused on client satisfaction in the private duty space, making sure that our clients are satisfied with our care.
No, that's great. Maybe just talk a little bit more about the problem. Now, I've had to provide and work with caregivers for both my parents who now passed away, but it's a challenge. And maybe you could kind of describe to us, what are the challenges that Hartford Healthcare was really trying to solve?
Yeah. So the challenges are that we're going into an unknown type of situation. So everybody's home is different. Everybody's care plan is different. So the problems are all individual to that specific client, but really trying to make sure that we encourage our clients to stay healthy, stay independent, and remain in their homes, but doing it in a way that still motivates them and makes them feel empowered to live independently and safely. So we were able to use Wellbeat to kind of support that mission, which is to keep people safe and independent in their own homes.
Yeah, Ravi, can you talk a little bit about sort of what was your approach? I mean, first of all, team matters. I mean, and I think we hit it off immediately. We're still looking to do a pilot of some sort at our company. Maybe talk a little bit about your team. Why is it that your team, what's special about your team that really worked well with Brittany and hers?
So, first of all, it was an amazing opportunity to work with HHC. The challenge was very, as Brittany said, there was a big challenge to start working now with seniors, people in the population that we weren't used to, that are 80, 90 years old, and also seeing those CNAs, the caregivers that are supporting them at home, and to see how we can simplify their work. The beauty at the Wellbeat team is that the team is coming from different angles. So we have psychologists, we have therapeutics, and we also have even people that are chronic patients. All those people together with people that are coming from AI and from ML, combining those brains together. This, I think, what makes Wellbeat so unique. If you will come to one of the meetings, you will see that it's not just technical people communicating. So there is a lot of energy in the room because different from other fields are coming. But I think by really spending time with Brittany, spending time with our team, understanding the day by day and how they work, and then we went back with our system. We tried to understand how we can simplify it from, if you remember, we came with 8 parameters and we said, no, we want to do it as quickly as possible. And we gave the guidelines that work much better. And I think that the correlation of working together, listening to their needs, understanding it, and being a part of it was an amazing experience for us. So thank you for that.
Yeah, we've got a question from Susan Winkler, which is great. What's the biggest hurdle that your clients face in adopting this new form of healthcare? And just the added twist, I'd say, from my perspective, is what's different in Israel versus here in the U.S.
So it's interesting, but we're actually not just looking at population from different culture view, but we are looking at each and every individual. And if you will come to Israel, you will see that you actually find people from across board, all the global. It's not just Israelis, it's not what you think they are. And I think the same we can say on people from Hartford. We have to start understanding that when we looking at each and every individual, we can't just look at gender, age, culture, and those parameters that we are used to. We, of course, looking at it and taking it into consideration when we're analyzing the different profiling. But we are looking at other profiling and other understanding, such as what are the barriers, motivational approaches, and others. And when we analyze that, we can actually work with population that are as old as those seniors, but also with young ones, okay? And I think that by understanding that you can work wherever you are, if it's in the UK, if it's in the US, and also in different countries at the US.
How have you been able to work through some of the fear with the situation that's going on right now? What have you been doing to help mitigate that? Really, either one of you, because you're both within the healthcare space.
Well, yeah, and I could. Yeah. I'm real curious because I would say, on one hand, Ravit, it probably makes your tool much more valuable. On the other hand, I would think that showing people how to use new technology, how do you do that? Unless they know how to use Zoom like we do, how do you explain this on a telephone?
Okay, so I have to start because it's something regarding Brittany. We actually started before the COVID-19, and when we wanted to go and to train each Brittany's team at HHC, Brittany said, no, you're going to train me, and if it will be easy for me to use, I will be able to train them, and if I will see that there are any issues or any feedbacks, I will come back to you. And it was an amazing experience for us because it was the first time that we actually trained one person that knew how to take it ahead and to go and bring it to the culture of their organization. And it went so smoothly. And I think it's because of Brittany, of course, not because of us, but it just, it went so well. And what this experience, we actually took it after that for the COVID-19 period. And what we did is the same thing with HMOs in Israel, that we support them remotely because we couldn't train them. We did all the integration also remotely. And we are now running a proactive service with one of the HMOs in Israel. We already have 700 chronic patients on the system, which is enormous, with 70 different caregivers who are running with the system. And it's because of the excellent experience that we had in Hartford.
Oh, that's excellent. Greg Flynn is on here, and Greg, you've done a great job selecting. And I'll tell you, we've gotten great feedback from a lot of startups and how well they've taken the startups and placed them with carriers like Hartford Healthcare. So, Brittany, on the on your end, and we actually do have an investor, Keith. Hello, thanks, and I got the volume tuned up. He wanted I create the lights went dim for a few minutes, but hopefully hopefully it's kicking up. From an investment standpoint, if you were looking at how much Hartford Healthcare would have valued the put a price tag on solving this problem, is it higher or lower? Pre-COVID, post-COVID, for what Ravit and her team is potentially bringing to your organization.
Yeah, I would say that it's invaluable really just to begin with. And then I think with COVID, it increased that value tenfold. And, it's already valuable in and of itself because it's allowing the caregivers to feel empowered to do their job every day. It's simple, really easy terms to encourage their clients. But, with COVID happening, you have to get creative on how are you going to communicate with your team and how are you going to allow them to feel empowered to do their jobs every day. And I think with the Wellbeat team, we were able to do that, thankfully, pre-COVID, so with the training and a little bit of the startup in the very beginning. But once you get the ball rolling and you're familiar with Wellbeat, I think it is, with COVID and everybody staying separate, and a lot of these clients, they can't even really see their families or other healthcare providers. They can't go to see their doctor, or they can't go to see a nurse or something. With this caregiver coming into their home every day with the tools and the tools they really need to make sure that their limited time is more valuable. I think that was really critical with Wellbeat.
Oh, that's excellent. A question for you at Hartford Healthcare. I mean, you've been very active in Upward Labs. You just did this whole digital healthcare lab. How many POCs do you have running right now with startups in the middle of all that's going on right now?
Yeah, so we're in between right now, in between cohorts. So we thankfully finished the first one right towards the tail end of COVID. So we were able to kind of wrap that up nicely. But we were piloting 3 companies at that time, and now we're looking at the next group of companies to pilot. I'm not sure what that looks like in terms of how many or the timing of it all, just because of the uncertainty right now. But we are looking to pilot a whole nother round of companies.
And kind of thinking through, like, what does the next sort of 12 months mean for innovation at the hospital? Has this changed the agenda? Has it changed the way you work with startups? I mean, how would, if Ravit were coming here now, how different would the experience be, interacting with your teams and taking something to pilot?
Yeah, so it definitely has changed things in the sense that we're focusing a lot more on telehealth and monitoring our clients in their own home without having them to go to and from the doctor's offices. So even when everything opens back up, I still think that clients or patients are going to be a little hesitant to go to the doctor more frequently. So we're looking at how do we keep them home and how do we provide all of the services to them from their home or on a telehealth platform so that they don't have to keep coming in and out of the hospitals or in and out of their doctor's offices. So I think that's more of the focus now. And improving communication. So whereas we're in the private duty space, so we're looking at more of those relationships. So how can we help our clients stay connected, whether that's to their families, to their caregivers, to their nurses, so that connection is really important, especially when the isolation is so severe right now.
Interesting. Ravit, in Israel, how is if you looked at the market before this, afterwards? I know Israel's been way out in terms of adopting apps and for the contact tracking and things. How is this changing your business strategy going forward for the next year?
So first of all, you could see that it really shortened the time of, for example, taking decisions, integrations, and so on. A lot of things that were only on a strategic thoughts became a tactic because of the same needs as Brittany just presented. It's the same thing in Israel. And we actually didn't change the strategic. We only deeper that. We now received from a lot of different hospitals now that never contact us before, the same as what Brittany said, okay? They realized that being only with omni-channels won't work as well as they wanted because they want the relationship. They came with the same wording as Brittany is saying, and they wanted to make sure that the ecosystem is working well. If we speak and creating a standard of care, there was a new wording that you never heard before in Israel, for example, that they were talking about standard of care when we looking of creating the right relationship, being more efficient and effective towards the way that we running programs, health programs. And they also wanted to start analyzing and having a better understanding of, for example, which caregiver will be more suitable for different personas. Things that we never had those things. Now, because of the telehealth, because of the telemedicine, they can start thinking about those things. And using our recommendation engines can support them on that and supporting the different omni channels that they're actually working with.
If you had to estimate, because we've talked to a lot of different folks since this all began, and everyone's saying that the speed of innovation has just crept enormously. If you had to guess how many years ahead this tragic event has put us, how many years do you think we just kind of sped through? You to guess.
I don't know, Ravi. I think from maybe you can speak to that a little bit better. As an innovation company, we're a little bit removed from that. So, I mean, I think personally for us, it has certainly sped up the need for innovation. So, whereas it was something that, okay, we can get to that maybe next year or maybe the next fiscal year with a different budget, we'll get to that eventually. It has completely wiped out, our future planning, and has said we need innovation, we need new creative solutions right now. So, at least from an agency perspective, we definitely have seen an increase in value.
So I agree with Brittany. We can see that the telehealth and the telemedicine, for example, people were talking about this trend for the last 10 years or even 15. Okay, so nothing is new in a way, but the call to action is what is really new. And what I feel is that people are now analyzing the technical different platforms in different way, which I love it. People understand that just to bring another app or another video won't make the difference. Okay, it will be an excellent platform in order to know how to communicate, but you need much more than that. In order to create, for example, what Brittany and her team are bringing to the independence at home, those seniors, okay, to the families, the security, the feel of family, okay? Those caregivers that when they're coming once a week, twice a week, they are part of the family. They are not just another CNA. And we see the same with rehabilitations. When you're coming for 3 months and sometimes for 6 months, you want to know the people. So what I feel is that people looking for deeper understanding, deeper, I would say, the healthcare organization are starting to understand that they need a combination of AI with ML, but with a lot of human understanding. Mm-hmm. And this is something that is completely new. And I think this will short, when you ask me how many years, I think what was supposed to be happening in a 5 years time, I think it will happen in the coming year. So I think yeah. And we are actually ready for that. We are completely ready for that. What we did in the last quarter, again, it's amazing. And because we could do it, we could really reconnect everything and saw what was working well and what didn't. And I think I would say another thing, the COVID-19 just reflect the real situation that we are into. Lack of resources, lack of, and I think Brittany can say much more on that. We know that the population, the seniors, is just increasing. We saw the ARP reports and all the other reports. We know that we have to think differently. It's not because of the COVID-19. it's because we have to think differently. We have to know how we can really recreate a new way of health in the coming future, and I'm saying it in the coming years. So I think being part of organizations such as AHHC, that I don't know if you saw the amazing work that they did at the last quarter with all the ecosystem of Connecticut, which is enormous. I think we can create beautiful things. And I am actually looking, Paul, to come back to Hartford when I can fly back. So I will be back to see how we can work together.
Oh yeah, well no, likewise. So listen, we're absolutely looking forward to having you come back and doing more. Brittany, hey, thanks so much for joining us. I can only imagine how busy your day is. We really appreciate the time.
Thank you.
Laura, we had obviously a busy week the last 2 weeks with our own Solvathon. I don't know if you want to talk about that. Maybe talk a little bit about who's up next.
Sure. So up next, this coming Thursday, we have a Redux. So we have Mark Duclos and Kurt Gem from Century Commercial. We had them on, oh gosh, probably the first week that we were working from home, talking about the future of shared workplaces. Well, it's going to be an interesting conversation because we, in Connecticut, at least, we're in phase 1 now. So what does that look like? What does it actually mean? And are we going to get to phase 2 soon, or is that going to take more time? So that's kind of the conversation looking forward on Thursday.
Yeah. Hey, well, listen, thank you so much. And all of you, thanks for listening, tuning into the show. We're getting better at the technology. My laptop is not smoking here, which is a good thing. And we stay connected. So I think the world's getting better. We're putting ourselves together. And listen, can't wait to see all of you in person soon. Thanks.
Thanks.
Thank you. Bye-bye.